how to start an exercise routine or how to start a lifestyle change. It takes more than just putting on a pair of sweatpants and Converse high tops and going to run in the street. I really think that if you're in middle school, high school, or college, it's good because you usually have coaches. If you're in organized sport, you'll usually have a coach that watches over you, several coaches. If you're in a club sport, you'll have a semi-coach and then the experience of other players kind of watching out for you. But if you're in a midlife crisis and you want to make a lifestyle change because you're tired of taking medicines, you're tired of gaining weight, tired of just feeling lousy, there's no coach available. And the only thing that's accessible is either friends who have made the change or personal trainers. Now, I have all the confidence in the world with very good personal trainers. I think the exercise physiologists, the ones that have gone to college and had the degree in exercise physiology, I think because they understand and have had training in the disease processes that most humans have, they might serve some of my middle-age, high blood pressure, pre-diabetes, high BMI patients a little bit better than a personal trainer. But it's all good as long as you have a coach watching over you. Even a yoga teacher, Tai Chi teacher, martial arts teacher can give you guidance and make sure that you're not going to get injured. There was a study out of JAMA that supported the use of vigorous exercise in a shorter amount of time compared to moderate exercise that was twice the time. So it was comparing whether if you do 30 minutes of moderate exercise or 15 minutes of vigorous exercise, the benefits. And it actually, the paper was swaying more towards supporting the vigorous exercise in a shorter amount of time, which is really cool if you you're pushed for time, you're overscheduled, and you want to get an exercise routine on, and you're wondering if that really helps you. It's nice. It gives you reinforcement that that high-intensity interval training is worth it. The only problem is that if you're beginning an exercise routine, you can't jump straight from couch potato to vigorous exercise. You're going to have a problem. And if that's your goal, which is a fine goal, and you have nobody watching out for you to watch your gait, watch your technique when you do your CrossFit, watch your technique with your plyometric jumping, you're going to have an injury. You have to be careful with that. That's why I think it really takes a doctor, primary care doctor, to think outside the box. The primary care guys can think outside the box to look for or clear you of impending doom or silent disease. Remember, Alberto Salazar is a famous marathon runner, the Boston, the New York. Even in the Olympics, he did well, but in his retirement, while he was still teaching other marathoners, I believe the story was he dropped to one knee and he woke up with 4 new vessels in his chest, and that's a marathoner. So sometimes we have or carry silent disease, and that's why it's important to get looked at by a qualified doctor. If you can find a primary care doctor that has sports medicine background training, I think that would be best, but you kind of have to do what's available to you in your area. But that's where the pre-participation physical would come in handy if you're in middle or late age. Now, if you have medical disease, you should always get clearance first. When I used to work with Cirque du Soleil, I had a lot of those middle-aged folks, or 30 to 40-year-olds, were ex-Olympians, so they were excellent with what they did. They had the genetic potential to do a lot of vigorous exercise straight out of the gate, no warm-up. But again, those are Olympians, and they're trained for it. So the idea with my beginners is you want to be able to figure out a baseline, and that's usually get a baseline blood test, like make sure you check your cholesterol and for your risk factors, check other things that your doctor will look for. But I would set a goal for at least checking or following your heart rate. Now, there's a lot of digital gadgets that will check your heart rate, monitor your heart rate, monitor your beat-to-beat variability, and actually extract with a formula how much oxygen consumption and the VO2 max you're going through, but don't worry about that. You can do it the old-fashioned way. The old-fashioned way is taking 220, subtracting your age, and then taking 60 to 80% of that total. That would be your sweet spot for where your heart rate is supposed to be during your every 5 minutes of exercise. Now, the ways to check you take your heart radar to find your pulse, which is usually at the thumb side of your wrist. You just take 2 fingers and press lightly at the thumb side and you'll feel a bounding usually. If you hold it there and feel the bounding, that's your pulse. You count the amount of pulses within 60 seconds, and that's your pulse rate. You can also check your carotid arteries here, but the older you are, the more dangerous it is when you press on this thing, especially if you have cholesterol issues. You can have a plaque, press too hard and you let go of a plaque, and that's your stroke, which we're trying to avoid with exercise. But I would stick with the pulse at the wrist, or get, again, a cheap instrument that'll help you monitor. There's a lot of good ones out there that kind of just monitor your heart rate. You can also get to a gym, and most of the gym treadmills will have these 2 bars that use resistance, and they check your pulse rate that way. So if you have a good guide as far as what to do, my pulse rate, at least when I started 20 years ago, I'd always shoot for 60 to 80%. And now I'm 53, so my pulse rate, at least my maximum heart rate I'm supposed to shoot for, to me, is a little bit on the low side, and I've been cleared as far as heart disease, stroke, aneurysm. So I actually go a little bit different than the standard. I go to 100% of my maximal heart rate. So my heart rate will sometimes go into the 180s. And sustained too. I think I have a great buzz out of that. I get not only a serotonin rush or serotonin high from my meditation, but I get a definite endorphin high from hitting that heart rate the way it is. That's usually done with either running or high intensity interval training, HIIT. Whatever way you use, that's the way I do it, but it took me about 20 years to get to that point. That is not the way you should do it when you're first starting out. Again, if you can get a coach to guide you, if you get a monitoring device to help you, a lot of the Fitbits will count your steps. I think some of them are coming out where they can actually watch your heart rate too, and they can chalk up or record those things. The data can be given to your doctor and you can analyze. So it is important to watch your heart rate. I usually say try to shoot for, when you're beginning, 5 to 10 minutes, 3 to 5 times a week. You expand that in about 2 weeks. Hopefully you have no injuries or no aches or pains. Listen to your muscles and your knees. If you have a treadmill, that's fine. If you can walk outside with a walking program, then that's fine too. But you expand that about 5 minutes every week thereafter. So you're kind of pushing the envelope. If you can get to 30 minutes, 3 to 5 times a week, that's what the American Heart Association suggests as far as a baseline amount of exercise that might increase your odds of sustaining or making it to 90 years of age without many medical problems or conditions. Sometimes if you don't have that much time all throughout the week, you can kind of compress that into 1 or 2 days on the weekend. Either way, it's totally up to you, but just be careful. I wouldn't go straight out of the gate looking for vigorous exercise. I would just try to make it a sustainable change. Again, if you look at my videos, I usually plan on making a change for 3 months, holding it steady for 3 months, and then kind of floating for the next 3 months. I think if you can make it past that, usually you'll be able to sustain that kind of lifestyle change or add to it, subtract from it, or get to a coach can modify the things to make it even more exciting for the seasons that come up. But the bottom line is, if you are sustainable with small changes and you mark these things off on the calendar, again starting with a baseline somehow and then moving your way up, and then doing the proper nutrition, and then also including some form of relaxation, your chances for sustainability are high. So you don't have to go straight for what the JAMA study had suggested is vigorous exercise, although it does decrease your chances for heart attack, stroke. I think it increases your chances for injury. So it's only for the very gifted athletes, like my guys at Cirque. So if you can, great, do it. If you can't, get a coach to watch you. If you can't even get a coach, then get some kind of monitoring device and start jotting it down on the calendar so you can see the nuances of your change, and it'll be a reminder, oh, it's 2 weeks, I got to increase another 5 minutes because Saguil said so. That way, by the end of 3 months, you're hopefully going to, no matter what the intensity, mild, moderate, or vigorous, you're getting to a complete time slot of about 20 to 30 minutes, 3 to 5 times a week, or condensing that to the end of the week. That'll be about a 3-hour workout, but whatever works out for your schedule will be important. Again, to me, it's not really what is considered vigorous exercise, moderate exercise, or mild exercise. To me, it's just the fact that you make a change and you sustain it. If eventually you get bored of things, then that's when we say, okay, let's push it to vigorous exercise, but only with the eyes of a coach watching out for you. The beauty of physical therapy is that they can sometimes, if you come to see me, I'll screen and I'll get you to a physical therapist before you get on that journey to an exercise routine. That way we fix any kind of deficiencies. Just like nutrition, if I feel that you're having too many cramps, if I feel that your sleep isn't that great, I'll probably help you with some form of nutrition or look for deficiencies and supplement if necessary. If there's a cholesterol issue, it'd be important to take care of the cholesterol, the blood pressure, the diabetes first, and then change the medicines depending on how you respond to the exercise and the kind of weight you lose. Taking away one medicine, decreasing another, or combining them, whatever is easier. So it takes the guidance of a doc if you can get to your doc. Take the guidance of a coach if you can find a coach. Also takes the guidance of a registered dietitian to kind of manipulate and give you education on how to change your diet so that these changes will be for life.